Hello and welcome to this educational presentation that we hope you will find very helpful. It is called Cervical Pap Smear and HPV Testing 101, How to Have an Informed and Empowered Experience. I am Dr. Christine Matheson, naturopathic doctor, and I'm so honored to have Dr. Kate Hadfield with me today to educate and empower you on this topic so that you can have some questions answered and hopefully have a more positive and empowered experience at future pap smears and learn more about the benefits of new HPV testing. So we're going to get started here. I'm just going to share a presentation with you so that we can get started. All right. So welcome to our presentation. And I encourage you to take a few moments to listen fully, turn off any distractions so you can get the most out of this presentation. So what we'll be covering today is what is a pap smear exactly? What is HPV testing? What are the updates with HPV testing that you might have heard about? Why is cervical health screening important? A quick anatomy review, proactive strategies to have an empowering and less stressful pap smear and HPV test experience. What's important to know and expect? Options during pap smear to have more control. Some troubleshooting, like frequently asked questions that you might have. Other key strategies for women to be proactive about having optimal cervical health. A helpful free resource for you that you can take away. And I would like to start by telling you who we are. As I said, I'm so honored to have Dr. Kate Hadfield, naturopathic doctor, with me. She is a licensed naturopathic doctor based in Calgary, Canada, with a focus on women's pelvic health and a special interest in endometriosis, PCOS, perimenopause, and cervical dysplasia. And I think she's an incredible resource on this topic. So we're lucky to have her with us to guide us through this. And this is something she's very knowledgeable about and certainly has some nuggets of wisdom to share with us today. As I mentioned, I am Dr. Christine Matheson. I'm a naturopathic doctor as well and licensed in Ontario. I practice in Toronto, Canada, with a focus on women's pelvic and abdominal health and a special interest in supporting optimal immunity and a resilient nervous system. All right, before we get started, it's always important to say that the information and content provided in this presentation is for general and educational informational purposes only and not professional medical advice. So if you have any questions or concerns or want to learn more about pap smears and HPV testing, of course, we encourage you to speak with your own doctor or other qualified healthcare professional to make sure you customize this information for your needs. All right, I'm going to hand, not quite yet, over to Kate. I'm going to tell you a bit about what is a pap smear. A screening test that checks the cells of the cervix to ensure no abnormal changes. So abnormal cells can change over time and can become cancer in some situations. PAPs can miss some abnormal cell changes. They are administered by a healthcare professional using a speculum, which we're going to give you some visual of in a moment, inserted into the vagina to collect a sample of cells from the cervix using a plastic broom. And HPV testing is a test for the presence of HPV genetic material of high risk types of strains. It can be self administered now. This is a new development that is rolling out very gradually in different regions at different paces. It's an easy to use at home swab, and it can also be easily done as a swab during a Pap speculum exam. It can be helpful to determine a course of treatment with certain types of Pap results. And it is great to have this option of the self test kit in communities with limited access to healthcare providers or those who might have a history of discomfort or fear of a speculum exam. So it is a great option that is now becoming gradually available. And I'll hand it over now to Dr. Hadfield to tell us about why is cervical health screening so important?
Well, thanks so much for having me as well. So Cervical health screening is really important, of course, because about 90% of cervical cancer can be prevented by having regular Pap tests, right? So, unless we're checking for either the presence of high risk HPV or for the abnormal cells themselves, we don't know what's going on in the cervix. And so, the earlier we catch it, the better the outcomes are long term. And that's what we're seeing here, too. So, we can detect abnormal cell changes at an earlier stage when it is easier to treat, right? HPV testing specifically can help identify those high risk strains that increase the likelihood of cervical precancerous changes. So that's why we feel like it's so important to do these screening tests. Next slide. There we go. So what is HPV, right? And how does it spread? So HPV is that virus that is everywhere, basically. And it is what's causing those abnormal cell changes. So if you have abnormal cervical cell changes, it is because of the presence of HPV. HPV is spread during skin to skin contact or sexual activity. And this is just a really great little diagram that shows you how it spreads and then the difference between the high risk and the low risk strains. As it pertains to abnormal cervical cell changes, we're more concerned about these high risk HPV strains.
And I'm just going to share a little bit more about HPV and its impact. So, HPV stands for human papillomavirus and it's the most common sexually transmitted virus in the world. The strain and the overall health of the individual really can affect the symptoms, including anything from warts to cell abnormalities that can lead to a variety of cancers. So there are over 100 strains of HPV. The high risk strains have a higher likelihood of developing into cancer. And as the infection persists, it may trigger precancerous changes in the cervix, which can lead to cervical dysplasia. So nearly all cervical cancer cases test positive for HPV. 3 out of 4 sexually active Canadians contract HPV at least once in their lifetime. And another statistic is genital HPV is the most common STI in the United States for both women and men. About 79 million Americans have HPV. So it's so common that 80% of women will get at least one type of HPV at some point in their lifetime. So it's really important to emphasize how very common this is. Even though it is extremely stressful, when it happens for you, like you probably want to know that you're not alone in this. And that's an important message we also want to relay today to make sure you're not feeling alone in this journey if this is you or a loved one who's going through it. Male reproductive systems are just as susceptible to HPV. HPV strains 16 and 18 are the most commonly associated with cervical cancer, causing about 70% of cervical cancer cases. And cervical cancer is the fourth most common cancer in women globally. So high risk strains can develop also into oropharynx, throat, tongue, tonsil, penile, or oral cancers. So that's also important to be aware of. There have been some new updated guidelines that are occurring and gradually coming through and spreading out throughout Canada and the US and around the world. So, human papillomavirus DNA PCR testing has a higher sensitivity than cytology based screening, so your Pap smear. Testing for high-risk human papillomavirus will soon replace the Pap test for primary cervical cancer screening in Canada and in other parts of the world, as it is more sensitive test that's been shown to be cost-effective and safe. So, for example, Ontario Health recommends also making some changes to the age of when screening should start. They're increasing it to 25, age 25, unless an individual is immunocompromised, because this is supported by moderate evidence indicating limited benefits for individuals under 25. So, as I said, this varies from province to province and state to state or wherever you're located in the world. Just to give you an idea, though, British Columbia and Canada is leading the way with new HPV testing being in the news, with their self-screening program helping to detect cervical cancer sooner. That was a big breakthrough in Canada, and a lot of the leadership is coming from this province. And this is what the HPV testing self kits are going to look like. There are various companies that will be providing them, and it would be a kit that a woman can take home and simply swab and follow the instructions on herself and return. and submit, or if more comfortable, can be done in office with a practitioner. Okay, so now we're going to do a little quick anatomy review and also demonstrate a little some of the um, tools that are used for pap smears, etc. So I'll hand it back over to you, Kate.
Thank you. So I think an important thing to really highlight when we're talking about cervical health is actually just to address what is the cervix. In my practice, I find that a lot of women don't really understand what this part of the body really looks like and what it is. So when we're looking at this slide, you can see that on the left, the drawing there is part of the uterus and then the vagina. And then that little section that's highlighted, that's actually the cervix. So the cervix is part of the uterus. It's not a separate structure. It's just a portion that we can see, right? And then the photo that we've got here is actually what a cervix looks like, right? So it kind of looks like a donut. That's what I say in practice. And the center of the donut there is the cervical canal. And so if you went into the cervical canal, you would wind up in the uterus proper itself there. So I think if we can just stop the share for a moment, I can show a little section that I have here. So this is one of the anatomical things I have in my room here. And so we've got your rectum, uterus, vagina, and bladder. And so this portion of the uterus here, this is the cervix specifically. So it's really important to understand that it is part of your uterus, because I find that most women just don't know that piece of information, right? So we can go back to the presentation just for a moment.
Oh, hold on, right there. Oops, there we go. Just finding the presentation. There we go. Do you
Oh,
see
look
that?
at that. Perfect.
There we
Yeah,
go.
we're all good. And then we'll
Yeah.
go to the next slide.
Mhm.
So more pictures, because pictures are great to learn with. Again, we've got that full picture that people are really used to seeing of the uterus, the ovaries, that type of thing. This is not how it looks like in the body, actually, but it's just a good visual. And again, you can see that portion of the cervix highlighted, and you can see terms like endocervix, ectocervix, transformation zone. Those things aren't super important to know just kind of on the regular, but it is helpful if you are getting any type of cervical dysplasia diagnoses, because they will talk about where exactly the problems are found if they were able to locate the transformation zone on a pap exam. And those become a little more relevant to know. And I really like this photo. It's just a really good visual to help you understand what potentially that diagnosis occurs for you. And then the visual on the right there is actually what HPV looks like, right? All viruses look different, and that is actually what the HPV virus itself looks like. Just interesting information. Next slide. So how is a pap smear done? This is really important. I think it's helpful to understand the steps involved, and it really helps to decrease anxiety if you know what's about to happen. So this is just a visual using a speculum, showing the broom itself, which is the collection device on the cervix, and we'll go through those as well in just a moment. So next slide. So why I think it's really important to talk about PAPS in general is that it doesn't have to be a really stressful experience, and it should absolutely not be a traumatic experience, right? We can really take advantage of this opportunity to learn more about your body. And it can even be an opportunity to reclaim a sense of empowerment, right? So what I say at the start of every speculum exam is that this is a sensitive exam, but it should never feel invasive, right? Like, let's call it what it is. We're not looking in your ear, right? It's a sensitive area of the body, but it does not have to be invasive. And if it does feel invasive for whatever reason, it needs to stop, because it just doesn't have to be that way, right? Another important thing to consider and remember is that you can actually impact the health of your cervix. A lot of women are told, like, oh, come back in 6 months, something was abnormal, we'll just see you then. It's that wait and see approach. And, maybe you opt to do that, but you don't have to. There are so many things you can do to positively impact the health of your cervix, and it's just not discussed in conventional medicine. And so that's really important for the discussion piece here. Next slide.
Thank you. Yeah, I agree.
Mm-hmm. All right, this one. Yeah, this is still me here. Here we go. So, and the more reasons that this is important, so many women have had traumatic PAP experiences, and we just kind of expect that it's going to be difficult, that you just need to lie there, be passive, and focus on the fascinating tiles on the ceiling. And it doesn't need to be this way. And I think the more that women talk with each other about positive pelvic exam experiences, whether it's a PAP, a speculum, pelvic floor physio, whatever it is, then we increase the awareness that we don't actually have to settle for poorly done exams. It doesn't have to be that way, right? And the more we talk about that, we actually decrease any shame that gets associated with these exams too. And there is this like a significant amount of shame, I would say, associated with these. So the more we talk about positive experiences and what it should be, we decrease that from happening too. Okay, so what to expect, right? I think it's very, very important to have clear communication about the steps of the exam before they happen, right? So what I tell to my patients is that you will find I'm very chatty during a PAP exam because I want you to know exactly what's about to happen before it happens. So I don't want there to be silence and you're lying there in a vulnerable position wondering what the heck is going on, right? That should not be how it goes. It also allows you to anticipate when touch is about to occur. So that doesn't come as a surprise, right? So there's a lot that can be done on the part of the practitioner to make sure you understand exactly what is about to happen, right? You can always opt for an exam that does not have stirrups on the table or does not have paper gowns. I use a basic massage table with no stirrups. I have never had an issue with it. And there's nothing to say you have to use the gowns or robes that are offered to you. Just wear comfy clothes. You're the most comfortable in it. It's not a big deal, really not an issue. A really big thing that most women don't understand is that speculums actually come in different sizes. I've even had nurses as patients who did not know this because the clinics they work at only stock one size. So I'm going to show you some some actual speculum sizes now so you can understand what the different options are. So we want to stop the share. Perfect. Okay, so this is a disposable speculum, and these are the ones I use. You just toss them when you're done. And this is considered a small, right? And so this is really why they're small, is the size of the bills here, right? And when we compare that to a medium-sized speculum here, you can really appreciate the difference between the two. This is medium and this is small. It's quite a significant difference, I would say, right? Um, and like I tend to use the mediums, but I have used the smalls a lot more than I would expect to have used. It does also come in large sizes, and so this is the large. I have had to use large on occasion, but it's quite unusual that I have to use a large. So I would tend to default to the medium. But if anyone is nervous about it or knows that they have pelvic floor tension or a bad history with PAP exams, just go with the small. It's super easy. And worst case scenario, you're not able to find the cervix because perhaps it is too small given your anatomy. You just throw it out and start again. It's not a big deal. Another thing to keep in mind is the little broom. So this is the little broom that actually goes into the cervical canal right here, but it's very soft. Like you can see, I'm just like touching it like this. It's very soft. And I would say most women don't even really feel that part, the actual collection process of the PAP exam. But that's what it looks like as well. So let's go back to the slides.
Mm-hmm. Yeah. Just a moment.
Mm-hmm.
There we
No
go.
worries.
There we go.
Perfect. So we talked about speculum size choice. And always remember that you're in charge. If you want to stop at any point in time, the exam stops immediately. I always say to my patients, I don't try to negotiate with you. If you say you're done, you're done. Full stop. We don't have to talk about it after that point, right? Let's go to the next slide. So options to really have more control and feel more empowered. Pick a healthcare provider that you trust and you feel comfortable with, of course. And as I said before, we really want good communication with our healthcare providers at all times. Like we just said, speculums come in different sizes. You can request a smaller size. Even if you start the exam and you're like, ooh, that doesn't feel so good, ask to stop and try a different size, right? Your comfort is the most important thing. An option I give a lot of my patients is with the insertion process of the speculum, because it tends to be what women are the most anxious about, is the discomfort they can experience with how the speculum is inserted. So there's nothing to say that you can't insert the speculum yourself, right? You can easily reach down and the practitioner can just help you guide the angle, but you can be in charge of the rate and the pressure essentially. And the advantage of the type of practice that I have is if, the insertion process takes 10 minutes, we're just hanging out and waiting for that amount of time. There's no rush with any of that. So I think that's a really important one to remember, is that you can be in charge of that. Another thing that I like to offer, just because it's fun too, is that once we find the cervix, you can always request to have a photo of your cervix with your phone, right? It's obviously a bit of a difficult part of the body to see on your own, and it is a really cool part of your anatomy. So you can always request to have a photo taken. I do them all the time. No big deal. So, next slide. Yeah, and so also important to remember what can come up after a Pap exam itself. Like if you've had a previously traumatic experience with a Pap, reach out to a friend that you trust or potentially a counselor. This is true if there's been, a history of abuse or assault, things like that. And absolutely seek out a different healthcare provider, right? You don't need to settle for this, right? Ultimately, if you've had a really negative experience and you just don't want to do a speculum exam, consider HPV testing at this point in time, depending on what's available in your area. And there are some private options that you can access. If it's not available in your location yet, you can purchase certain ones online and do it yourself at home. So that's always a nice option. If you know that you have a history of challenging Pap exams, whether that's because you have a pelvic floor dysfunction, endometriosis, dyspareunia, all of these different things, and they're really challenging for you, try to find a provider who has additional training in pelvic floor conditions or has a more empowered approach to administering a Pap exam, right? Because you will just have a better experience ultimately. Okay, some fun troubleshooting things. Some women will know if they have a difficult to find cervix. They'll know that like their cervix sits a little more posterior, like it just tends to be higher. You can try to aim to book your appointment after your period, but before ovulation. The cervix tends to be harder to find the closer you get to your period. So if you want to really try to game it that way, you totally could. If you know you have a lot of pelvic floor tension, you can insist on using a small speculation with small amounts of lubrication. We were initially taught that you can't use lubrication, that you can only use water. This is shown to be untrue. You can use lubrication, and those things can make a lot of difference for a speculum-based exam. Even just focusing on deep breathing and connecting in with the pelvic floor and trying to relax those pelvic floor muscles can really help improve the comfort level during a speculum exam.
Okay, hold
All
on.
right,
There we
next
go.
slide. Yeah, there you go. Back
Okay,
to
there we go.
you.
Yeah, so I'll just start sharing a little bit more about how there are other proactive strategies to optimize cervical health. But first of all, thank you so much, Dr. Hadfield, because those are such valuable tips. Like, I don't think we get taught those things, pre going into all of our medical appointments. And there is an education side of it to feel more prepared and to know what your options are. So those are all really great tips to find the right provider to work with that allows you to feel that you have more control of the process and you understand it and that you're part of it and you're an active participant. So thank you. Those are great, valuable strategies to be aware of and to remember every time you need to remember that this is your health and this is your body. Speaking of that, there are other proactive strategies to optimize cervical health that I just think are really important to end on this presentation with. That there are evidence based nutritional and lifestyle strategies that can play a significant role in helping to optimize the immune system. And Dr. Hadfield did mention and refer to that earlier. So I just wanted to start by focusing on a few. There's many, but the top three that I would maybe highlight for you today would be improving sleep quality for immune health has been shown to help your immunity. And so by having sleep good quality means, you're having going to bed at regular times, you're getting at least 8 hours or more of sleep. Quality sleep means you're actually into a deep sleep, ideally. There are all sorts of tips around sleep, having a dark room, for instance, keeping it slightly cooler. There's all sorts of strategies to improve your sleep quality if that is an issue for you, but that could help to optimize your immunity. Also, obviously, what we eat affects our optimal immunity and health overall. So, optimizing your nutrition, particularly for good gut health. We know now that 70% of our immune system lives in our gut. So, if we learn about the right fibers to eat and the right plant foods to eat to help feed that microbiome, that can optimize your immunity as well. And there are specific nutrients that support the body's response to HPV. And that's what I also wanted to highlight to you, because not many women and men know this, that there could be specific nutrients that they want to look out for that are commonly deficient actually in people with low immunity or who may be dealing with HPV. So I'm just going to share what those are if it lets me move forward. There we go. Nutritional strategies for immune support. So, the following vitamins and minerals have been related with supporting cervical health and the body's response to HPV: folate, a form of folic acid; vitamin A in its pre-vitamin A form carotenoids; lycopene; vitamin C; selenium, which is an important mineral; vitamin E; and zinc. And then there are these incredible nutrients derived from herbs: broccoli sprout, green tea been used for thousands of years, both orally and topically, for HPV, reishi mushroom, astragalus root, and AHCC, which is a proprietary blend of shiitake mushroom. And so we're, really wanting to position you in a place here that you feel more empowered. So having more knowledge and diving into learning more about this area of how you can be proactive could also alleviate some of the stress or some of the concerns that you may have of how you can be proactive during that watch and wait period between your visits so that you have some strategies in place, obviously with the help of a healthcare practitioner to see what's appropriate for you and what is customized for you. So again, these are some powerful clinically researched nutrients that we know can support the immune system. Just a nice visual for you of some of the sources of where some of those vitamins are. So we've got avocados as a great source of vitamin E. We've got spinach as a source of folate. And then we've got the citrus fruits as a source of vitamin C. And of course, our carrots as a source of carotenoids. And those are some images of what some of those herbal medicines look like as well for you. So if you're like me, I always like to have a takeaway of everything I've learned and have a place that I can go back to learn about it. So I just wanted to share a helpful resource for you that is sort of a great summary of some of the things we've talked about here in terms of proactive strategies that you can start today to control your health. The link is there if you want to source that, and it's yours for free to help. Thank you for joining us today and also have a takeaway so that you can refer to it. I do want to end by, and I'm just going to make sure you can see both of us again. I think if I stop share in a moment, we'll be able to see both of us again But if you have questions or want more information, Dr. Hadfield can be reached via her website, yourpelvicnd.com, and Instagram at yourpelvicnd. And I have my website there too, ChristineMathesonND.com, as well as my Instagram, Dr. Christine Matheson. So I'm going to stop the share so that we can say a proper goodbye and also make sure you can see both of us. There we go. So thank you for joining us today. And I hope that you do feel more empowered about approaching having a Pap smear and a HPV test. If you have any questions, feel free to reach us out to us via Instagram if you want to have some more support. And the most important thing is for you to take charge of your health, feel more proactive, and educate and empower yourself. So thank you so much, Dr. Hadfield, for joining us and providing again those valuable tools. There's anything you want to end on to wrap us up today?
Just, I think the mantra that, like, PAPs are sensitive, not invasive, right? And it's a great opportunity to feel more empowered with your health.
Yes, I agree. And I feel like that's a really good note to end on because we do want to acknowledge that it can be a sensitive experience, but there are some strategies that we've shared today, which we hope you take and allow you to feel like it is a more positive, more empowering um, experience, but also that you can share this with other women too, because I feel like this is a dialogue that we need to open up in the women's health community so that we all feel this as a sisterhood, that we can
Mm.
navigate this because it is important to protect and to monitor our cervical health, and there's ways that you can do it. As we said, there's also new ways with new HPV testing that are going to make it easier and easier as well. So thank you so much for spending the time with us. Thank you so much, Dr. Hadfield. So happy that we could share this information. For all the people listening and who are going to be hearing this recording, we wish you all the best. We wish you wellness, and thanks so much for joining us.